Lincoln Electric and talk with them about putting African Americans and Hispanic people to work. And I had a site at the Maydugan Center on the west side, and I had another site at Corey United Methodist Church, and we were at the Glenville YMCA, and also on the other side in Joe Jones Ward, and we ran these job fairs. And I would take people to get jobs, and I had a radio show on Cleveland Talk Radio 1490. It was Kevin Conwell, the jobs man. And now, what we must do with these places like these companies that's knocking it down and knocking down quotas, don't shop where you can't buy. Simple as that. Boycott them. Don't shop where you can't buy. Don't go to any place where they won't hire people of color, African Americans, Spanish people, whatever the case may be. Don't shop where you can't buy. And we got to get people to vote and do the census. We got to, because we're standing on the shoulders of our people. We just got to talk about MLK. He fought, but your grandparents and your parents fought right along with MLK so that we could get ahead. And this stuff is serious, man. It really, really hurt me. It really, really hurt me. I'm looking to do, I'll be meeting on February the 7th at UCI. You guys could come over there, Eugene and Cash. I'm meeting with all the key stakeholders and Severance and University Circle. And we're talking about putting people to work and creating a job link, because work is therapeutic. And it shouldn't be that you have East Cleveland and Glenville and Huff right around that area and you have all this abject poverty. So we're going to discuss that. We're looking to put together a job fair and have a job link, because when you have University Circle there, people should be coming from those communities walking to work the way it used to be. They should be able to walk to work. They should be going to the Natural History Museum, the Arts Museum, Botanical Garden, and places like that. And we should be working right there, because work is therapeutic. Because one of the things I believe in, if you want to keep crime down, you have to do away with idle hands, and you have to put people to work. And you got to believe in that power of work. So we sit back and we listen to executive orders after executive orders. We have money and we have the purchasing power, and we can do things ourselves, and we don't shop where we don't work. It's disturbing. It's really, really disturbing. It's not a good thing, but we can't sit back and say things like, oh, we survived before. We survived before. No, we got to do things, and they got to be all hands on deck. And that's how we do it. And then we have to go downstate, and I'm just flustered with it. Sorry. Director, come on, move forward. With that, the Committee of Health, and Arts will begin. So, come on. Ordinance number 422025 by Council Members McCormack, Conwell, Harrison, and Griffin by departmental request. It's an emergency ordinance authorizing Director of Public Health to transfer property located at 4242 Lorraine Avenue to the control, possession, and use of the Department of Community Development or Economic Development, authorizing the sale or lease of the property to Penrose Holdings, or are they here? They're not here? Or is designed for future redevelopment, authorizing the Directors of Public Health, that's you, Director, Community Development, Economic Development, Penrose Holdings, to enter into a development agreement relating to this ordinance. Are you going to narrate what we're doing for council? Yes. So I yield to you, sir. Matter of fact, this has been approved by the Community Development, City Planning, as well as the Director of Finance. Director.
Great. Thank you, Chair. Thank you to the committee. Thank you, council members this morning. So we're really excited to work through this legislation where the McCafferty Health Center, which is about 1.5 acres of land in the Ohio City neighborhood, will become affordable housing for with 72 apartments for low-income seniors. And so to my right, the person who's been leading this work for for the last couple years now to get this to the finish line is Bureau Chief of Neighborhood Revitalization, Trudy Andruski.
Thank you, Director. Thank you, Council, for having me. I have a brief presentation to walk through to explain the transfer legislation that we're here to discuss today.
And you and what, are you in a?
Department of Community Development, Bureau Chief of Neighborhood Revitalization, again, Trudy Andruski. And this has been an amazing cross-departmental collaboration. I would love to continue to see more really wonderful partnerships between community development, public health, economic development. There have been a lot of great stakeholders throughout this process.
What are the homes going for in that area? About 340, 400,000? This is good.
Yes.
This is good. All right.
All right, I'll jump in. The city-owned site we're working on is 4242 Lorraine Avenue, where the current McCafferty Health Center site building is located, owned by the Department of Public Health. The site is located at the intersection of West 44th and Lorraine Avenue in Ward 3's Ohio City. It is also located in the Lorraine Avenue Local Landmark District, so it will go through Landmarks Commission for design review process later down the line. In fall 2024, so just a few months ago, the Department of Community Development issued a request for qualifications to attract real estate development firms to create much needed affordable housing at the site. I believe that the ability for the city to support affordable housing projects citywide, and in particular in amenity-rich neighborhoods, creates incredible opportunities for the success and positive quality of life that current and future residents may be able to experience at this site. Here we just want to outline for you the main scope of the RFQ, which largely, again, is to construct affordable housing alongside ground floor social service and nonprofit space. These are the development requirements shown here. We put forth to development partners, which will also include having public amenity space, ensuring that there's extensive community collaboration throughout the design process, and ensuring that the development partner will have participation from businesses who are certified with our Office of Equal Opportunity. The RFQ was structured again in partnership with the Department of Public Health, Department of City Planning, Councilman McCormick, and Ohio City Incorporated, with strong support from the Mayor's Office and the Mayor's Office of Capital Projects. And I want to highlight this slide just briefly because I do believe it's important to recognize housing cost burden in the neighborhood currently. As Dr. Margolius, we often hear him say both eloquently and directly, housing is health. And in community development, we of course share that value. But we believe that providing high quality housing choice for all Clevelanders is a key component of equitable development. And by our definition, equitable housing opportunity means that we need to both maintain and create housing opportunity where individuals do not have to pay more than 30% of their income on housing, be that a mortgage or rent. So projects like this are an opportunity for us to play a part in reducing the intense housing cost burden of Clevelanders at various income levels, and in this case focused on the rental market. Here we're just showing some data from the American Community Survey. The map visualizes data of housing cost as a percentage of household income by census tract. In the census tract where the McCafferty site is located, nearly 40% of all renter households surveyed were spending more than 30% of their income on rent, and in adjacent census tracts, that percentage increases to 45 and 52%. Highlighting just briefly that at the beginning of July, the city and Ohio City Inc., in partnership with Councilman McCormick, released a community value survey to continue refining what values and needs are present in the community that we can attempt to meet through this redevelopment opportunity. Chair Conwell mentioned earlier the May Dugan Center. They were an amazing partner and collaborator in helping to distribute this survey to some of their clients. In addition to May Dugan, we also worked with the Westside Catholic Center, the Spanish American Committee, and the Young Latino Network to help get this survey circulated, and working directly with caseworkers to administer the surveys on site as well as circulating it digitally. This is just the first round of engagement that the project team will use as a foundation. They're already have met with block clubs and with a meeting at Ohio City Inc. Our next engagement meeting is scheduled for February 10th. Just briefly walking Sure. Luckily, it's recorded, so if you need to backtrack, but yes, I'll slow down. Sorry, Councilman. The awarded proposal, so just highlighting that briefly, through the request for qualifications process, we selected Penrose LLC to serve as the lead developer for the site and co-owner. They will be partnering with Ohio City Inc., the area CDC, as co-developer and co-owner. We think this is a great opportunity to help the area CDC build capacity. The proposal will be pursuing low-income housing tax credits through the Ohio Housing Finance Agency's 9% tax credit program. That application is due in February. The proposal consists of 72 units of senior affordable housing. Those rents will be between 30 and 70% AMI, and it will be a mixed-use development. So ground floor spaces will be dedicated to both office space and nonprofit use. Those specific tenants are yet to be defined. Penrose did explain have an emphasis on environmental sustainability that will help reduce utility costs for tenants, but also create positive public health outcomes. It is a transit-oriented development, so we're working with the proposed Lorraine Midway in order to ensure that project can move forward successfully. It will go directly in front of the site, and then also ensuring that the community spaces at the development are well programmed. Penrose is working with City Architecture, John G. Johnson, and Innova Services on the design, and it will be managed by Penrose Management Company. And again, this transfer legislation will help us evidence site control for the 9% LIHTC application that's due in February. Lastly, a brief project timeline. So again, right now we're working towards site control for the project team, and they will submit their funding application for low-income housing tax credits in February. We will know of the award in May, and then from there we'll move forward into more intensive design review approvals, securing additional financing, developing construction plans, and submitting a building permit. So we hope that by this time next year there will be a financial closing and transferring the site. This legislation just enables us to do that, enables us to enter into development agreements, but we don't anticipate transfer until this time next year, with construction slated for June 2027, and then hopefully full occupancy by the end of 2027. And that is all. Thank you. Yes.
Can you reach out to Director Tyson? I just saw former Councilmember Zach Reed leave. Can you reach out to Director Tyson for me from OEO? Can he come down? I need to see him for a second. Thank you. You know what? I heard all of this. So where are we at with when we start executing on this project with African Americans and minorities? You got to put it in. I don't care we get sued or whatever the case may be, but we got to put it in there. So where are we at, Director? We're having them build the project as well as through the whole 5 phases of the project.
Sure, we are in the extremely early phases. The developer, Penrose, was selected just at the end of last year. The RFQ process occurred in fall 2024. And so when we enter into a community benefits agreement based on how much funding the project team will apply for from the city, that is when we will begin negotiating all of that. The Office of Equal Opportunity did participate in the evaluation committee for this project, so they're already engaged in the conversations, but they're not yet at a point of starting to select subcontractors or anything like that.
So you in the implementation of the project right now, is that correct?
We are in the first phases of implementation, so design development, initial funding applications, those are the current steps.
You got African Americans on that project team, and tell me something about Penrose.
Good question. So Penrose has done a couple projects in Cleveland. They're currently working on the Warner Swayze adaptive reuse at East 55th and Carnegie. They've also done a couple projects, affordable housing projects in the city that I'm happy to share more on. I believe one is in Ward 5, Councilman Starr. Sankofa Village, I believe.
Because you know, Councilman Starr, what you think about them? Because we give them money, it's taxpayers' dollars also. And it's our residents' money.
No, so I was going to ask for a point of clarification. I know they're working on figuring out how much money they will ask from the city. And within that, it will also require a community benefits package. But I'm also interested is, do Penrose have any partnership or marriage with a minority-owned development company that can work on the project, not subcontract? Subcontracting things out does not bring equity into a project. So what I look at for projects when it comes with a developer, what type of relationship do they have with the minority developer, whether it's a partnership such as a collaboration, part ownership or something, because you can't continue to say, well, we just don't have people that can subcontract it out to do the work. How can we bring more general contractors that is on the project from a standpoint of bringing things together similar to what we're doing with the Goodwill Building with International Food Solution?
2295 East 55th
Yep.
Street.
So my question is to the chair is, within this relationship with Penrose, and they're going to ask for some dollar amount, do they have a partnership with any minority developer or construction company that can bring some equity into the project and not just have them subcontract out? Through the chair.
The co-developer at this, thank you, Councilman. The co-developer at this point of time is Ohio City Inc., which is the area CDC, and they will co-own and co-develop the building. And then the construction company at this early phase in the project that they've identified through their RFQ submission is John G. Johnson Construction. So as far as additional companies, I do not believe that there has been conversation or coordination on that yet. Again, they were selected to work on this project at the end of 2024.
Through the chair, to the table, is there any way that we can get the actual RFQ process and also the reports on who did what they actually look like? Because I'm not, correct me if I'm wrong, is Johnson G. Johnson a minority construction company or anything through the chief? Or are they registered OEO? Because that's very important. You know, this is taxpayer dollars, and you got to have diversity in a project, but also within that diversity, we can't just expect a general contractor just to subcontract out and say, hey, we gave some dollars. And that's something that I'm looking at for projects, definitely for my support on votes on different things. Through the chair.
And through the chair, so at this point, we're not, this legislation isn't to give them any money, it's to enter into site control so they can apply for funds from the state.
But he's putting it out there on the
Yeah.
record so that they know
Good.
that's
Okay.
where he's at.
Good.
To make sure that there's minorities there.
Of course.
And we got to do that on every piece of legislation now.
Yes.
Isn't that true, Councilman?
Yes, because like I said, I've dealt with some different projects since I've been on this council, where things were said, things were mentioned, and I believe if it's not in writing, it doesn't exist. So within these projects, if we're using taxpayer dollars, and there should be some type of participation and support to help minority, and throughout all projects when it comes to dollars that is being spent from the city.
Right. Agreed.
So because you're in the implementation of the project, and you let the director, you let them know in the outstart, and we're going to do that on every single project that comes through here. Director Tyson, we know we're discussing, and Councilmember Starr just got finished discussing this project here. Here's the project. We want you at the table or your staff at the table to make sure that minorities, African Americans, people of color, you have a seat, that we are in on every single project, and you need to monitor every single project. You know, because you know why we're saying this. We're discussing it.
Yes.
All right. And are you in the implementation of this project here?
Let me take a good look at this. Can you give me, somebody sum this up?
McCafferty Health Center
Oh, yes.
Barbara sat on the evaluation team more in early phases of it, but we'll be working with you on the community benefits agreement, but that isn't triggered yet. They haven't applied.
You're speaking to the mic before you're not projecting. Sir, we want you to hit every single project, not just this project, for every single project to make sure that we're there and graded and continue to grade. Director?
Yes, we will definitely do, the OEO will definitely monitor these projects, but more importantly, we can focus on coming up with a plan going forward. Usually what happens, people get into these situations and they do not necessarily have a plan. They find out later, hey, we have to do this, we have to do this. So we get on the projects early
Right.
and set a plan, because if you don't have a great plan, you're definitely not going to make your goals.
Right. It's in the implementation of the project, and you see it all the way through. Not only is there a system set in place, not only to look at the capital of the project, but also the operations. I don't think we have that.
No, Councilperson, we do not have that, looking at the operations, but some of the things we're trying to add later on the community benefits, when we come back to the table, we look at post-project hiring requirements, because oftentimes we focus on pre-project and temporary jobs, but what are the post-project hiring requirements that we can implement going forward? We actually have the power now, because of the community benefits ordinance, to do that, because of the catch-all clause that we have there, so we can actually look at that.
Yeah, we want that. We want that. I mean, and then you know what? When you come to finance, I just took over your question.
You good?
When you come to finance, you bring that to us. The background history of this Penrose, I don't know them. Are they? Is there any issues with them? I don't know.
I'm not familiar with them. I've heard the name, but I'm not familiar with
So that's why you have to bring us. I don't want to just go by, they're good. I mean, I can't quantify that. I can't even, they're good means what to me? The A, B, C, D, good. Bring their background history, and also bring the background history that Councilmember Starr asked you about, the partnership, the background history of them actually working and bringing on minorities. Because if they haven't been doing that, then guess what? Their energy does not compel them to be that certain way. When you do something, then you can measure their energy, because their energy is to bring on females, African Americans, people of color, because their energy compels them to be that way. If they don't, then I'm sorry for pointing at you.
Oh, it's okay.
You have to monitor and control to make sure that we're there.
I'm with you. Last thing I'll say, we got to really create that expectation. It's in certain cities, there's an expectation, whether it's written down or not, that you will come with minority female participation, not just on the construction level, but on the architectural, the professional development side. So that's what we're trying to do, is create that expectation.
Got you. And then by you, how do you create it? They see you there, you coach a council, or you give oral warnings, or you do the write-ups?
Well, we are creating expectation through the other projects that people are seeing. I'll give you an example. Rock and Roll Hall of Fame just entered into a community benefits agreement voluntarily. There's no city financial dollars in the Rock and Roll Hall of Fame, and they're doing the community benefits. I was actually just reviewing it. That's what I was doing.
Greg is good. Greg
Yes.
is good.
So people are getting the message of how important we feel that community benefits are not just the racial and the gender part, but community benefits in and of itself, the overall part.
That is good right there. I like Greg. Greg, he's a visionary. He's able to see around corners. He's a good dude. That's my number one. My number one museum is the Rock and Roll Hall of Fame.
I wonder why.
That's my number one, man. I live in there. But I need you to stay, because we're going to discuss some other things. If you could stay for a minute.
Yes.
And I'm there. The barriers to you mentioned the barriers also to affordable housing, access to affordable housing. So the barriers are what? I mean, you put it up there, but you didn't narrate the barriers. Is it?
Sure, yeah. Yeah, no, through the chair, thank you. And this is why this has been such a passion project for Councilman McCormick. It's gotten so expensive to purchase a home in his ward that early on, I think he said 10 years ago, he had a conversation with Mayor Jackson about, a guarantee that this site would become affordable housing. And so took us a minute, found some like old blueprints from 2007, 2008 in my office when I moved in of the McCafferty renovations to include affordable housing. But we're there now, and this is a huge opportunity for at least 72 seniors to live in this neighborhood and stay in place.
That's good to hear.
Yep.
And amenities around there is what you got? Drugstores, grocery stores, and those kind of things. And
Yeah, you're right, and importantly, just in terms of the vision, it's right on Lorraine, so transit-oriented development, and so folks can live there without being dependent on a car to get everything they need. They can walk, they can take the bus on a high-frequency transit corridor. So it's a big deal. This is a huge opportunity for us.
I know he's pushing it. He's championing it. In my neighborhood, Ashburn, University Circle area, the homes are going for $350,000, $400,000, and then so we put University Hospital on Chesterfield, and we have affordable housing above University Hospital. So now we're looking to bring in the May Dugan Center, and we're going to break ground, and we're going to put affordable housing above that as well. And he supported it, and he said, "Kev, this is what I've been looking for anyway in my neighborhood." So he let me know about that a year or two ago.
Good.
So I know he's there.
Good.
Because you got to mix it.
Yep.
You have to mix. You can't just have people with homes going to that. The comps are good also, in the neighborhood. Any other question on ordinance number, council member?
Thank you. Just a couple quick questions. And I think Dr. Margolius actually just answered this. We're talking about the adaptive reuse of the current building, not demolition and construction of a new building.
No. This would be, through the chair, this would be demolition and new construction.
Oh, it would be new construction.
Yeah, because if you look at the site right now, it's
Okay.
like all parking lot.
Yeah.
And
I was wondering how you were going to get 72 units through the
Yeah,
chair into that
yeah,
current building.
it's-
And that, so this
Yeah.
that comes down in a
he
new.
told me.
yeah.
Okay. One other question then. Well, two questions through the chair. Is the project expecting to come back to the city for additional financing or funding later on? And if so, do we have a ballpark on what that expectation might be?
I'm happy to share the initial sources and uses that they pulled together as part of the RFQ process. I don't have that off the top of my head. I do know that we would expect a request to come in after we understand the 9%
Okay.
a tax credit award, which we'll know in May.
Because that was my next question, Mr. Chair. These are complicated finance structures, and a lot can hinge on people in Columbus making decisions whether or not to give us these what are they called? LIHTC.
Yeah.
And if the LIHTC doesn't come in, that entirely changes the scope of the finance package. So there's a lot of still things to be considered in this whole project. But right now, we're just looking at entering into site agreement with Ohio City, Inc. and Penrose through the Health Department and Community Development so that we can move forward with hopefully pulling this project off.
Correct, yes.
Understood. Okay, thank you, Chair.
Thank you very, very much. Any other questions on ordinance number 42-2025?
Thank you. I'm really excited about this project. I think it's a wonderful reuse of an important city facility. Can you just confirm, so that we have it on the record, if we do not receive the LIHTC credits that are applied in February, what happens to the transfer of the property through the chair?
Thank you, Councilwoman. We do not intend to transfer until the bulk of their financing is secured. So about 75% is the typical threshold that we work from. And so they'll have to go back to the project team will be responsible for going back to the drawing board and proposing what their financing capital stack will look like.
Excellent. So essentially, we are approving the transfer, but essentially the deed does not get signed until we are at the point of sufficient financing. And so there are structures in place that if those financing thresholds aren't met, the property will maintain with the city.
Exactly. We'll enter into a development agreement that evidences site control that will allow them to apply for financing. But until that substantial financing is secured and design review approvals are all given, then we will not transfer the site.
Great. Thank you very much.
You know what, you need to narrate that if this legislation is passed, when you go to finance, because that's going to come up again,
Okay.
about the site. We're not just giving it to them, and if everything fall apart, then they'll still have the site. We're like, no, we'll claw it back. and the systems in place that we can claw back the land.
Correct. Yes. Happy to articulate that further at the next committee. Thank you,
Okay,
Councilman.
thank you very, very much. Any other questions on ordinance number 42, 2025? So moved. Batter up. Thank you.
Thank you.
Thank you. I'll see you at finance.
And through the chair, great news is that the folks who are there now from the public health team are going to be moving into, or we've signed a letter of intent to enter into a lease in the Blanket Mills building down in the Clark Fulton neighborhood that Councilwoman Santana's been working on so hard. So we will come back to you soon for legislation to enter into a lease for 4,700 square feet in that space to continue our clinical services for the Clark Fulton neighborhood.
That's fantastic. It's
Yes.
fantastic. Council Lady, come up to next people. I got a family and return a phone call. Give me 1 second. Step out.
No, I believe we have, Lita, I believe, yeah, presentation.
A presentation.
Yeah. Good morning, Commissioner.
Good morning.
Did you already say? Commissioner, feel free to begin when you're ready.
Thank you. Can you hear me?
Yeah, maybe we'll move it up.
I'll scooch up. Okay, that should be good. Use my Cleveland School of the Arts projection voice. All right, good morning. I'm Lita Wills, Commissioner of Health Equity and Social Justice at Cleveland Department of Public Health. I've been in front of this committee several times, but the purpose of today will be to provide an update on the progress of the initiatives that are housed within the Health Equity and Social Justice Division so far, as well as provide some insight and update to the direction that we're headed, as well as to cover several of the initiatives that are covering outside of the Public Health Department and span across City Hall, across city departments and divisions, with participation from most of those departments and divisions. This is just a little background for you. As you know, I tend to provide more information than I hope you ever need. But so there are several slides in here that are for your review, but also within the information that I sent over to Ibukun, you'll have the slide deck, you'll have the link to where you can find all of our materials for health equity and social justice on the city's website, including our interdepartmental equity team's 3-year strategic plan, which is complete, as well as our tool for health and equity impact assessments, and our full recommendations from the Equity Advisory Group. I'll go over those things a bit here, but you'll have access to all of that full information as well. As you'll remember, City Council adopted Resolution 296-2020 declaring racism as a public health crisis. That was sort of the impetus for the creation of the Division of Health Equity and Social Justice, which came the following March in 2021. Our mission is to improve the health outcomes and overall quality of life and to remove barriers to resources in order to create thriving neighborhoods and a thriving city. We use elements of Mayor Bibb's 2022 Equity in Action recommendations, as well as our, in close partnership with Director Tyson Mitchell and the Office of Equal Opportunity. He's my partner and kind of side by side on a lot of our equity initiatives. And that declaration by council also authorized the creation of Racism as a Public Health Crisis Working Group, which is now the RAFC Coalition. I will not focus on that work so much during this presentation because I understand they're going to be called to provide a presentation later this season for the HHSA. The through line to kind of remember for you through all of this work is that we are set up around social determinants of health. Sometimes people take umbrage to the use of the term social determinants of health because they feel like it's only focusing on health and excludes sort of that overall well-being that we're looking for. That's just sort of a misnomer. Those 5 pillars that you see there are the focus for social determinants of health. So we're focused on tackling issues through education, access, and quality, Healthcare, public health and quality of that healthcare are through our neighborhood and built environment. Also issues of social and community context, which can take on many forms, but can include things like the criminal justice system, can include things like child welfare systems, anything that has a social impact on the community. And also, of course, our economic stability pillar, thinking about economic mobility, economic stability, and any barriers that may exist to those things. I also want to sort of call your attention to another philosophy or way to think about these things in public health that we think about as a public health approach, in which for any given issue that we're tackling in public health, we define and monitor the problem. I'm sure that sounds very similar to your processes. We identify the risk and protective factors, understanding that risks are things that we can ultimately try and prevent. Protective factors are things that we can support to make outcomes better. We develop and test prevention strategies, and we assure widespread of the adoption of those strategies or taking those strategies to scale. And that's sort of the approach that we use with regard to our equity work as well. So thinking about social determinants of health and looking at these 5 pillar areas as a wonderful way to actually measure our progress and measure our equity work. This is just another graphic that I tend to use from the CDC around understanding health equity and what it takes to get there. If you think of health equity as sort of that desired state of where we'd like to go, where we'd like to be, there are several ways that we get there. You can get there through programs and services, sure. You can get there through measuring and monitoring issues. I, for one, think that you cannot get there without great policy. Policy is that third road on there. I feel like a lot of equity issues that we're dealing with and grappling with today are the result of very, very poor policy, and you don't get to overcome poor policy unless you make really awesome policy to take its place. Undergirding all of that, of course, as city government it will well know, is infrastructure and being able to have solid organizational structures that uphold the ways that we get to progress. If you'll recall, the 3 major buckets of work of the division of HESJ, we are situated within the Cleveland Department of Public Health. So we do have programmatic work and service work that happens within the Public Health Department. Within that, our division, we have the programs and projects associated with HIV, STI. We have the Minority Health Program. We have Moms First, which is our infant health and maternal health project that is supported by Healthy Start, and our OMAR team, which is Office of Mental Health and Addiction Recovery. So those are the 4 programmatic areas that we support within the health department. The other 2 buckets of work within the city of Cleveland, the equity initiatives that span across different departments at the city. Operationalizing equity and policy and procedure is our interdepartmental equity team, which I'll talk more about in some detail, and our equity advisory group that I'll talk in detail about as well, but it's a little bit more focused on the things that we would normally consider efforts around DEI or diversity, equity, and inclusion and belonging. Within the community, our office is the conduit between the mayor's office and that REFC, or Racism as a Public Health Crisis Coalition. And so I work very closely with our partners. Thanks, Tyson. I work very closely with our partners who chair that at Urban League and Cleveland YWCA to ensure that that public-private partnership is supported and that they're able to move on their initiatives as well. And it's important to note probably at this point that Racism as a Public Health Crisis Coalition within their framework are also stood up around social determinants of health. So internally, we're working along the same framework as the RAFC Coalition externally. Thank you. So within the administration, we reside in the Public Health Department. We are the newest division of the Public Health Department, Health Equity and Social Justice. Joined them officially in 2021. This is the team. Most of them are here today. Heading up our Moms First team, which is our infant mortality and maternal health program.
Yeah, but put the dads in there too.
Yes, we do have a fatherhood component for sure. Project director there is Khadijah Fair, relatively newly installed. On our Office of Mental Health and Addiction Recovery, Samantha Holmes is here as project coordinator, project director. Lydia Hill is the overall Health Equity and Social Justice Division coordinator. Mr. Rafiq Ali heads up our Minority Health Program as project director. And within our HIV/AIDS projects and programs, Ms. Tiffany Green is our project coordinator. It's a strong team, and they all have unique missions, unique focus areas, but we are working to serve the same populations within the city of Cleveland and working to better the health outcomes in these 4 areas.
I got a question for that.
Sure.
If we, because see, when you say moms first, 75% of the head of the household in my neighborhood is headed by females. And what you do when it's not just the mother is pregnant, it's the mother and the father that's pregnant, all right? And so when she says she's pregnant, we, plural, is pregnant. And as soon as the mother have the baby at the hospital, the dad is there and the child feels the heartbeat of the father. And that little girl feels the heartbeat of the first man that she would ever feel a heartbeat is her dad. But when you say moms first, you sending a signal saying that I see as a man, get back. You're kind of like pushing them back. So is there any kind of way we gotta say mothers and fathers together, the family? Because when you push family together, you keep crime down, you're pushing the mother and the father together. And when you say moms first, so the grant is really as a moms first grant. Is that correct?
The grant is a Healthy Start grant. Initially, it was named Healthy Start. The program name changed about 15 years ago to Moms First, and there are several other programs that are focused on the health of the mother, maternal health, as well as the baby. These are all programs to reduce infant mortality.
Right.
If you are suggesting that we change the name, that's something that you can certainly suggest to Director of Public Health or to the
I'll
Health
talk with
Department.
Yeah.
But I would just make sure that we are aware that the reason why it's called Moms First is because it is
Director.
It is primarily a home visiting program that supports the family around the mother and the baby, whether that's dad and a grandparent, or dad and multiple grandparents, or however that family structure comes to be. It is a home visiting program that provides prenatal care. So when the woman comes into the program when she's pregnant, and so the community health worker visits every month, at least once, most of the time twice a month, and then they have other ways that they interact as well and provide supports, provide education to enhance and supplement the prenatal care that they will get with their doctor as well, but also helping to solve some of those barriers of does mom have adequate transportation to and from her prenatal appointments? Does mom have adequate nutrition supports at home? Is she getting enough food? Is the family getting enough food? Things like just education around what to do when you bring home a new baby, safe sleep, making sure that we are embarking on smoking cessation while mom is pregnant for everyone in the house. That's a huge driver of...
One in the house.
Sure.
Director, here's the thing, and then we're gonna move forward.
And I do want to make sure that I am able to mention that every mom that gets enrolled in the program, her partner or the father of the baby
Significant other.
is offered Moms First services with our fatherhood portion of the program, the fatherhood program.
I legislated that a long time ago.
I know.
And
I wasn't here.
You weren't around. So here's the thing. The government, what they did with ADCU and ADC dependent, when the child got older, they said, we're good, we're gonna set you up on ADC or ADC medical. And back then, before you guys were born, it was general assistant as well. So what they did, they sent investigators to make sure that the father was not in the household. So these young kids growing up not seeing the father it's not in the household, that's not good. And so what you got continuation of, Director, when you say mom's first, you saying keep the dad out. Because it's how you narrating it. You keeping the father out, but to have a whole family, mothers and fathers together, even if the father is not in those programs, that he has to be connected with his children. And this is how a young boy grows up and know how to become a man by just having father involved in his life. And the same thing with the young girls growing up. That's why we had a father-daughter dance and the whole nine yards. But when the government says, they're used to the government making sure that the father is not in the household, and when you narrate, Director, and say mom's first, you're really contributing to the 70% or the 3/4 in the African-American community that there's no father in the household. You kind of contributed because you saying that words, actions speak loud words. Words kind of make that happen. Although you say he could come in, but he might say, can I come in or not? Because you're not making it inviting for him when you say mom's first. You got it. The father is just as equal as the mother.
Thank you, Chairman. With all due respect, I'm going to push back on you a bit. Number one, I did not name the program.
I know you did.
Number two, thank you. Number two, we do make it inviting for fathers.
But the name you saying mom's
Chairman,
first.
can I speak?
I know, but I'm passionate about that.
As am I.
Being a man, I'm passionate about that. You say mom's first. I say, dear, can I come? Then the wife will say, I don't know, or my girlfriend might say, my significant, I don't know. It says mom's first.
Thank you, Chairman. That is a lot of supposition. When someone comes into our program, number one, father does not have to be in relationship with mom to receive the same
Significant other, I
services.
said.
Sure. No, they don't even have to be significant other. If mom is pregnant and the dad is no longer involved with mom, he still, just by virtue of the fact that this is his baby,
Come here.
is able to have these services. They are contacted at the same time. If they come in with mom, that's fine, but they also then get their referral to their fatherhood coordinator right there. It's the minute they come in, right? They have entirely separate services from mom. They have a fatherhood support group. They have one-on-one case management and mentorship support from the dad leaderships in that program. We do a lot of separate outreach for dad specifically. I would hesitate to say that any father who's they can enter also, irrespective of if the mom is also getting services. They're able to get supports and services as well. So we do make a lot of strides in terms of whether or not the name of the project itself, and there are several projects that are centered around mom for sure, but also are reaching out in a co-parenting method. This is what our major funder, HRSA, is leading us to is a co-parenting model, right, where moms and dads are
Co-parenting,
equal. Sure.
okay.
Could there be a discussion about changing the name down the line? Sure. But that's, in terms of carrying out the program and the project every day, we do a lot of work to make sure that men and dads are welcome.
I think the director has something to say, too. Do you have anything to say on that?
It seems like the issue here is mainly the name, and I think oftentimes, I'm a man. I come from the community, and I'll just say the name. Men don't necessarily need much reason to leave, in a sense.
No, they don't.
But as Commissioner said, this is the name of the program, but it is encompassing, and it does include the father or the man in life that has, we come from extended family in the communities, particularly in our community. So, but no, valid point though.
Yeah, but we'll have that discussion, having them included, because it reminded me of, Director, before you were born, how the system was different right now, because you're including the fathers, but when you say certain things, it's like there's an exclusion there. And when you said they don't have to have a reason, well, we got to try to cut down whatever reason that is to bring them into it.
Yeah. And you,
Even when the baby is first born, that father should be there to cut the umbilical cord.
Definitely. And your point is well taken. Last thing I'll say is, you know, even we look at the midnight raids, looking at poverty law, looking at welfare law.
Yeah.
We had the midnight raids in our communities where the father was not designed, they were checking to see if you were actually there. And it didn't encourage the familial relationship. So we got to get back to that family relationship.
Yeah, we got to. And I'm just passionate about it. You know, growing up, you know, I saw those things that you never, and I got friends, they would send investigators to raid to make sure the dad is not there. And then now you look at the neighborhood, you see the crime, and you see the children are out of control, but it was the government that helped to break the families up to make sure the father was not in the household. And I want to make sure in this program, when you say Moms First, that we got to include that. And I heard you narrating it. I just don't want to have any barriers to push back on the fathers being included in their children's lives.
Thank you, Chairman, and to both of your points, if you heard me earlier when I talked about how we got here as a result of bad policy, poor policy, and we don't get out of that unless we enact awesome policy and put it in its place. So we're on our way to enacting awesome policy. I'm going to go ahead and move on. Okay, this is, and again, Council has these slides, so you're free to go through them in greater detail, but this is a good outline of each of our programs, where the funding comes from, who our subcontractors are if we have them, and what we're ultimately responsible for Moms First, Office of Mental Health and Addiction Recovery, Office of Minority Health, and our Office of HIV/AIDS. But I'll allow you to peruse that later. You will have them. Our major focus areas in terms of our health concerns are obviously in infant, early childhood, and maternal health. Addiction recovery is kind of specifically right now focused on the opioid crisis. Chronic diseases is what we cover a lot of in our minority health program, as well as mental health in our HIV, STI, reproductive health services. And I would be remiss if I did not mention the incredible work that the Department of Public Health has done through COVID and after COVID to rebuild our epidemiology team to be able to have us have issue briefs around all of these major health concerns and more with up-to-date Cleveland-centric data on all of these health issues. And so in the resources that I sent over prior to this, I did include a link to where on the CDPH website you can find the issue briefs around the newer lead program, our lead report that came out, our infant mortality and birth outcomes briefs, our quarterly drug overdose briefs. You can find these things at your fingertips. And most recently, one of the more recent and maybe first time in a while that we had covered this topic, we did put out in October a suicidality brief that showed some really important and if not alarming trends happening around suicide and the conditions that create increases in suicidality, specifically in Cleveland. And so I would encourage you to check that out. Sure. So in terms of our equity initiatives, these are those equity initiatives that move across city departments. That kind of falls into three main areas as well. And this is a screenshot of our web space that is on the City of Cleveland website now. If you just Google Cleveland Equity, this will come up. I did include the link in the materials that I sent over for you, and so you're able to see in great detail the items and materials around our interdepartmental equity team, our Racism as a Public Health Crisis Coalition, as well as our Equity Advisory Group. The Interdepartmental Equity Team, that is something that was stood up initially as our internal response to the externally focused Racism as a Public Health Crisis Coalition. So when we think about those social determinant of health pillars, economic stability and mobility, education, neighborhood and built environment, health and public health, social and community context. When you think about those 5 areas that RAFC is focused on externally, that is also what interdepartmental equity team is also focused on. We're just looking at it from an internal approach to where does the city have influence, where does the city have impact on those issues, and how are we able to make ultimately life and well-being better for Cleveland residents by monitoring and altering the way that we provide services and do business here within the city of Cleveland. So to that end, we were able to pull together a team of folks from all across different city departments at the city of Cleveland. We did not focus in that group on 2 major groups because they had very big initiatives of their own that were aligned, and so we didn't want to necessarily interfere, but that the things that we came up in this group would also speak to those, and that was our HR group and our public safety group, because they have very, very
About
large.
HR.
Yeah, they do appear in our equity advisory group, though, and so with our 18 to 20 or so representatives, which a couple of them are here, we did a number of things, and the first thing we did was we did some training and education. Tyson and I, Director Mitchell, excuse me, and I had 3 days of training around equity, around health equity, and around what does that mean for city workers and for the work that we do every day. So it's one thing to talk about social determinants of health to public health workers. This is what we do all day, every day, right? Is look at social determinants of health and understand the impact that happens across the city. It's a different thing to talk to someone in public utilities or someone in public safety and have them understand where does their work align with economic development, where does their work touch with social and community context, right? And so that we spend a lot of time really breaking down in each of our departments, where do you have impact on a health issue, or where do you have impact on the general well-being, in order for us to be able to get to discussions around equity, have some shared language, to be able to understand what do we all even mean when we're talking about equity, racial equity, health equity, social justice. What does all of this mean for us? And ultimately, where we landed is that it means making sure that we are acting in fairness across the board by every policy, practice, procedure, every service that we provide all day, every day, making sure that those things are A, quality, but also B, equitable across the board for the residents that we serve, right? So within the interdepartmental equity team,
So you have systems to measure the departments, you know, 'cause people reach out to me, I mean to me personally, and they talk about different departments of cultivating women, as well as African Americans and people of color, and they say certain departments, because they watch us on TV, they say, Councilman, they're not doing that. So when you do your strategy reviews, you guys discuss the departments and how they're cultivating workers?
yes. So again, there are some of that happens in HR, but and I'll kind of dive into this a little bit deeper in a few slides. We have also within our strategic plan, we've also created a health and equity impact assessment tool. The tool I'll talk about, but it's a way to measure whether or not we are being equitable in our practices, in our policies, in our procedures, right? And we'll be able to look at it here in a second. Of course, we're the conduit between City of Cleveland and the Racism as a Public Health Crisis Coalition, which several members of council have participated in, several people in the room have participated in and are supportive of. The Equity Advisory Group, and I'll kind of show you a little bit in our recommendations a little bit later, that is separate from the interdepartmental equity team. The interdepartmental equity team at this point, and we'll get into it, is really starting to be more involved with measuring where do we have equity gaps in the city, in our processes and our procedures. The Equity Advisory Group is a collection of folks who, when we did an equity inventory of initiatives across the city. While we may not have things that are specifically named diversity, equity, inclusion, we have initiatives that are working in those areas, whether you're getting at diversity through the populations that you work with specifically, you're getting at it in the different services that you provide, in the areas that you're concentrated on. We have a lot of different equity initiatives and work happening already, and there were some new things that came in with the Bibb administration. And so what we did was we did an overall sort of inventory of all of that work and tried to define, is this influencing racial equity? Is this influencing diversity? Is this inclusion? Is this belonging? Is this social justice? Where are we hitting these points, right? To be able to see where are the gaps, and also to be able to highlight and lift up the things that are actually happening, so that a lot of times what happens when a new strategy or a new focus comes out, we stand up something, say, just for instance, we could have stood up a DE&I department, right? And that would potentially have negated or overlooked all of the equity work that has been happening in the city of Cleveland for years. You don't get to be the city of Cleveland without working on diversity, equity, inclusion. It's who we are, just by virtue of where we are, right? And so we wanted to make sure that we were recognizing and acknowledging all of that work that had already been here for years and is continuing, as well as being able to understand what new things were coming and how they could all work together. Yeah. So I'll get into that. I wanted to also highlight the Cleveland Commission on Black Women and Girls, which I am also appointed to. And I see Eugenia Cash in the audience, as well as Commissioner Councilwoman Stephanie House-Jones. We all participate on that, and just we had talked about having a little bit of an update, just a brief update. Officially launched in January 2024. Catherine Hall is our chair. We have 10 commissioners seated, and I believe there are a few more positions that were open and had been receiving applications that the committee is working through. The committee work around, underneath that commission includes economic development, education, health fair, justice and civil rights, a membership and recruitment committee, as well as a public hearings and listening committee and a research committee. And if you'll see also within there, all of those committees harken back to social determinants of health. I'm telling you, we all work in social determinants of health, whether we know it or not.
You sit on the commission?
I do. I'm the mayor's appointee to this commission.
You guys putting systems in place to do what you need to have done?
Yes, we are.
Yeah.
We meet monthly. The next meeting is tomorrow at 4:00. They're open to the public. We've held, this past fall, we held one listening session that was very well attended, where we're just asking community, Councilwoman Gray has been involved with us as well, asking community, what are their major concerns for Black women and girls, and asking Black women and girls themselves, what are your major issues that you think that the city needs to act on, or where we can be supportive of. And so we're moving through that through our committee work, understanding what needs to happen with regard to health and health care for Black women and girls, also what needs to happen in a social and community context, whether it's around issues of violence, issues of housing, all of those things that are the things that get hard, right, are hard for us to move in the world. And where is it that city council and city government and city services can come together to help be supportive of improvements and changes?
That's
right?
a good thing. Would you guys putting together a survey analysis?
That would be
who's
on
measuring the survey?
That would be on the research team.
Yes.
I'm not on that committee, but we are part of our listening sessions with the community. We do surveying in there to be able to get the focus of the community documented. So we want to know who's there, what are your concerns, and understanding what their major issues are, so that we're moving with the community and letting them tell us what is needed and what's wanted, so that we can act on those things. Sure. You don't get that without polling and surveying and talking and having conversations and listening sessions, right? So that's how we're moving at this point.
And when you get the survey analysis, then you're going to take it, document it, move forward, and put it in your mission, so
Yep.
you know what
create
Touch
some
points.
objectives and goals, sure.
Yeah,
Yep.
that's good stuff.
Focus areas. Just want to, and if you need me to hurry along or whatever, time-wise, I'm going to walk you all through the work of the interdepartmental equity team. Again, you'll be able to access the strategic plan on the city's website. Just Google Cleveland, City of Cleveland Equity, and it'll pop right up.
I know I'm cutting across. I'm excited about the Women Commission. Do you guys plan to sit down and talk with us, City Council, and tell us what need to be, the outcome measures?
I imagine that would be on the
So last year, the commission already came to council, I believe it was in November, to give an update. Then when we do it, the, the reviews, committee reviews, what was it called?
operational.
Operational reviews. So yeah, they did present. And it is the intention of the commission. There are some consistent evolving suggestions when it comes to the legislation in and of itself. And we hopeful by the end of the year, they will be giving suggestions and things to council.
Yeah, because, Council Lady, if you don't tell me or you narrate it to me, if I don't see the outcome measures, I don't really know.
Sure.
I want to know, but you have to educate me because, that's very, very important for me to know. So if I have to write policy or manage policy, then I know the reason why. And if I don't know the why, or let's say if I don't know the way, then that's not good for me. So I want to understand it.
Thank you, Chairman. Of course, the
I'll be
work-
sure to make sure I send you that link of the
Yeah.
time that they did the operational review so you can make sure you're up to speed.
Yes, I know the way. I know you'll send it to me.
Yeah, I will.
Friend
I
of
absolutely
mine.
will.
Of course.
That's important.
And of course, if, as we move through any policy recommendations or suggestions, the process would be to come to council to educate and to ask and to help bring understanding to that goal. For the interdepartmental equity team, we had a little bit of a setback with our internal rollout, meaning launching the strategic plan as well as the health and equity impact assessment tool when we had our computer issues back in June. That once that all got cleared up, we were able to get our website presence live and updated. There's the link again. And we did hold a lunch and learn at City of Cleveland in September with online attendance as well as in-person attendance to go over all of our initiatives around the equity team as well as the equity advisory group. The data around that supports our interdepartmental equity team, if you go to our strategic plan and look at those 5 pillar areas, education, economic stability, building and housing, or neighborhood and built environment, and so on and so forth, there are indicators that we look at across the city to help us know, are we moving the needle? Are we going backwards? Are we going forwards? Are we making progress in each of those areas? Are we making progress in health and healthcare? Are we making progress in neighborhood and built environment? I heard you mention earlier when the legislation was up around being able to walk to things. And so one of our indicator areas that we can monitor and measure and understand is in what neighborhoods and how close are we to 15-minute cities, the ideal, right? Looking at within our neighborhood and built environment pillar, things like monitoring RTA ridership. Is that going up and increasing? Is it going down? Is looking at things like in our education pillar, making sure that we are understanding our levels of educational attainment here in the city. Is our graduation rate going up? Is it going down? Are we seeing more residents able to access certificates, trade certificates, degrees, any education past, job training, any education past high school? How is that shaping up, and what does that look like for our workforce development here in the city? So we do have within the strategic plan across those 5 pillar areas some very specific available data that we're looking at just as a city to know, like, where are we in all of this, but also then underneath those strategies or underneath those indicators, what are the strategies that the city of Cleveland participates in and has touched to that helps support that indicator to move it forward, to move us forward, right? So being able to look at the initiatives and programs and projects that we have here in the city of Cleveland, and are they doing what they need to do to move that larger needle?
Yeah, that's important. Look at the dependencies also.
Mm-hmm.
You know, like when you say, okay, here's my milestone. We should be here, let's say in April or May, but your dependencies would tell you if you're not moving in that direction, because something needs to happen, and things are dependent to get to a certain milestone. Those dependencies will help as well.
Sure. So that data is, it's the strategies and the indicators are in the strategic plan, and ultimately we are building a dashboard to be able to just log in and see, like year to year, are these percentages moving? And if you're wanting to know more about our efforts around neighborhood and built environment initiatives, you can go right to that section of the dashboard to see, are we seeing increased home ownership in Cleveland? Are we seeing increased owner-occupied homes? Like, what are we seeing, right? So you'll be able to ultimately access that data more readily when the dashboard is available, and that'll be through Clear Impact. This is just a short little timeline that kind of tells you where the impetus for the IET came from and where we landed, ending up at launching the strategic plan, except now we have to do the work of the strategic plan, right? You don't set your strategic plan on a shelf. It outlines your work for the next 3 years, right? And just an FYI, I
Done
think.
in your strategy reviews.
I think sometimes when we talk about racism as a public health crisis, we can get caught up in thinking about it as something that started when the declaration happened. And it was actually a long time before that I'd be remiss if I didn't mention my colleague, Commissioner Frances Mills, over the Health Division, and her work, correct.
Good.
And her work when she was over the Office of Minority Health, but in getting our community partners together, and also council representatives who were the ones who pushed forward that declaration. And that kind of started the year prior, didn't start, but it kind of culminated at the 400 years
You know,
of.
Francis was doing this kind of work before we put the framework director into the system. She was out in the neighborhood being an activist like Eugenia Cash and the rest of them. So you got some people whose heart is in it and not just doing it for a paycheck. 'Cause, Francis was out there in the 80s and 90s actually working, but she would come to work and I would see her out there in the neighborhood working, but she never went for any fanfare, but she was out there working. And then you turn around, director, and she's gone. But she was there, downstate, the whole 9 yards. So you got a good person with Francis.
Agreed. This is just as you go to the website to review the strategic plan, this is going to be how it's set up. Built environment and neighborhood section, economic mobility and stability section, health and public health, safety and community supports. And our groups that formed this also felt very strongly that we didn't want a separate section for education, because education has to run through all of these. It's the kind of the cohesive piece of this. And when we talk about education in terms of a social determinant, especially when we talk about the work that we do here at the city, we're not only talking about traditional K through 12 or, P16 education. We're also talking about the education that we all do every day to educate our constituents, to educate our residents, to educate one another around the issues. And that education happens in a lot of different forms. When you're going out in the community and you are talking to people and they are talking to you, there has to be a component of education where you're bringing people on board and to be active in the initiatives themselves as well.
You gotta cultivate.
Yeah, and so we wanted to make sure that we were highlighting the educational pieces in all 4 of these areas and not just getting so stuck or trapped on thinking only about K to 12 education or P16 education.
I got you. That is true. You're right about that. Let me ask the councilwoman,
Yeah.
she used to be the state rep, House Jones, a question. Is there a way, or do we have a commission on downstate dealing with women and African-American women? Is there a commission downstate like we have the Fatherhood Commission? And if not, could you guys create some legislation and probably lobby downstate so that we could have one in the long run? I mean, because you know the way. You're from there.
I would say at this point, this is not the appetite of the General Assembly that we have. So no, the first question is, no, there's not a commission of that nature in the state of Ohio. And in the society that we have, that is not the temperature of the Ohio General Assembly. But you should really encourage to talk to your state rep, state senator, and see who will be ready to, even push forth legislation of that sort.
Do you think, here's another part of the question, with the jobs and, jobs and family services, with the TANF money, temporary assistance for needy families, is there a way to tap into that money, state rep? Well, you give me the state rep look, but I always ask you.
So, again, it really depends on the nature and the appetite of the General Assembly. They have found, throughout General Assemblies, found different ways to come up with innovative programs, utilizing, probably the most recent one is the Bridges Out of Poverty. What is it? Again, yes, I think it's the Bridgeways Out of Poverty, that they are working with, certain counties to, look at workforce opportunities in areas and communities that have been hard hit to connect to the workforce. So if the will is there, a lot of things can be done. Again, the tenor and the temperature of the federal government, the state government are very similar.
Very similar.
And if you look at what the focus is in the legislation that they have been introducing and or passing, being inclusive of people who have been systematically hurt from government is not a priority of this General Assembly, let alone the federal government.
Yeah, that is true. That's a rough one. We just turn over every rock that we can and try to figure it out. When I talk about state, I reach out to my council member and I talk with Stephanie, Council Lady Stephanie House Jones about those things. So sorry to interrupt, but we were at that point. All right, thank you, Council Lady.
Thank you. I wanted to take a moment to walk through this next phase of the work of the interdepartmental equity team. This is where, again, we're measuring our equity and improving our equity and impact across city departments in our practices, policies, procedures, thinking about how do we find if we have gaps, how do we find if we have problems, and how do we improve them. And so we adopted the Health and Equity Impact Assessment Tool, which I'll talk about. It's meant to be very short and user-friendly. It's the work of the equity and the interdepartmental equity team now, where for this first year, since the mayor greenlighted us in the spring, we have members that sit around the table at interdepartmental equity team. Remember, they're from all over city department and all levels. We're not talking about directors and chiefs and commissioners. We're talking about the folks who are actually doing multiple initiatives or might actually be working on one particular process, and trying to get that a breadth of scale across city department. And so they were the ones to first say, I would like to, we learned the tool, we learned how to use it, we adopted it from the National Public Health, Institute for National Public Health Law, and worked with them to adapt it so that it would work for our City of Cleveland purposes. And so our team here at City of Cleveland were the ones to say, I am so-and-so from the water department, I would like to run this equity tool on our blah, blah, blah process, right? And so we've started we've got a few done, and we're broke up into groups around that neighborhood and built environment, health and public health, social and economic mobility. So those groups are taking the health and equity assessment tool and doing them on the projects that coincide with their subject matter area. right? So I have the folks who work on economic mobility and stability working on an assessment of a program or a policy or procedure that aligns with that, right? It's a little bit different than having everyone look at it, but we all come back together to show our results, and so we'll be able to walk through that. It's really short, but it allows us to pull in some information and data about a policy. It can be used on current policies, current initiatives, current programs, or if you're proposing a new policy, initiative, or program or process, you can run it on that before you actually start, and it'll give you a sense of where might we find an issue with equity here or an equity gap. Just as an example, we might be offering a service in the city department that residents can sign up for, and they sign up for it online. If we run the data on who actually signed up or took part in it, and then we start to see, it looks like more Westsiders are accessing it, or it looks like more people between the ages of 20 and 40 are accessing it, right?
You quantifying it.
That might tell us that there could have been an issue that this was an online sign-up only, right? So now we're thinking about areas of our city that may not have connectivity access, or looking at, age-wise, are we leaving seniors out of that process, or are we leaving folks out who, just don't have the ability or capabilities? So being able to look at that sort of granular effect, either after we've done a project or before, to see how can we do it better. It also allows us to look at not only things like equity and access, it allows us to talk about and discuss whether or not there would be a negative health effect of pursuing this particular process or practice or policy or program. And so the steps to this project are basically you gather data around it, like what is all the information, what is the program, that's step one, is establishing why the program or policy or process is being reviewed or proposed. Why are we looking at this? Who wanted to look at it? Right now, we're kind of piloting it so that the folks who are on the interdepartmental equity team are bringing things from their departments and saying, hey, we need to look at this program, or we need to look at this policy, right? And then that group is workshopping it through this tool. Step two is explaining the context of the program or policy or process. Step three is determining the impact on internal and external partners. Step four is identifying potential outcomes, good or bad. Step five is considering other pathways. Could you do something different here? And step six is making it sustainable. Now, using this assessment tool is never to say, if we find that your policy or your practice or your initiative has a negative equity impact, is never to say you can't do this program here, or you will not get this contract, or we're stopping this project right now. It's to say, let's have this conversation and think about what can we do differently to mitigate that potential effect. If it's a negative health effect, let's say you're thinking about a construction project that is going to have to remove 30 trees, right? It allows you to understand what the impacts of removing 30 trees from a neighborhood might be, but then allows you to think about it in a different way. What are some things you can do to offset that, right? It allows you to have that conversation
I know what you're talking about.
rather than being a punitive measure
Talking
or
about
tool.
risk and also
Yeah.
looking at risk analysis.
Yeah, so kind of in the grand scheme of things for our interdepartmental equity team, this is right out of the strategic plan. And
What
so
you could do, when you do that also, do the SWOT also with it.
a SWOT analysis? Sure.
But,
Yeah.
but at the end of the T, you look at the threats and the trends. The SWOT, the strength, weaknesses, what is it? Strength, weaknesses, opportunities, threats, and then add another T for the trends, because you got to study lessons learned.
Yeah, I would say, I'll show you a couple of pages from the assessment tool itself. It's similar, it's just maybe a little bit more in-depth of a process than a SWOT, but it is getting at those same things, like what are the good impacts happening from this? What
Yeah.
are some potential bad impacts are happening, and how do we address it?
How you
right?
address it. And then you shoot over the risk.
Yeah, so the point that we're on now in terms of the interdepartmental equity team, we are on the implementation phase with the health and equity assessments. And so using them on policies, process, program recommendations across City Hall, having regular IET meetings. They meet in their small groups, and then we all 5 pillar groups come together to workshop. We assess this process of this policy or this program. Here's what we found, right?
Right there, I like that. Who set that up? Was that you?
Yes.
You set it up?
Us.
That's like a project team. You got the small groups, they do projects, they work together on different issues and concerns or whatever, and then you bring it in together.
Yes.
For the big piece. You're like a project.
That is definitely the approach that we're using. And then making sure that we have an annual report on all of that progress. So being able to, at the end of the year, making sure that we're communicating, we did this many assessments on these particular processes or policies, and these were the outcomes. These were the recommendations made to move forward.
Let me jump in there real quick. The other thing here that I'm excited about is it gives us the opportunity to look at who's been left out. So, you know, if there's a plan to replace the LED light bulbs across the city and in our street lights, well, who decided we're going to do the west side first? And then we're going to get to the east side. And then by the time we get to the east side, those have been left out. So when you say things out loud and you look at them, you have an opportunity to mitigate. So maybe instead of doing the west side first, we're going to do a coordinated approach. So it gives the opportunity to say these things out loud, and then we can try to mitigate as a group.
And I love the
You
idea.
evaluate, I like an evaluation process. You're evaluating what you just narrated. I like that.
And also the very idea of who makes up the interdepartmental equity team, where they're coming from in their departments, and having so many folks on board. We have folks from sustainability, we have folks from utilities, we have folks from public safety, or we do have a couple of people from public safety actually, from public health, from all over, to who may not look at it the same way as if you had only a public health team looking at it, right? We're actually tapping into the expertise of the folks who are doing work across different city departments, and there's really nothing like getting that type of expertise in real time. The assessment tool, as I mentioned, was adapted by us with support from the National Public Health Law Institute, is a jumping off point for the IET. This ultimately is the meat that will keep the interdepartmental equity team going. You know, we'll continue to do these assessments and come back together and make recommendations, and therefore be able to understand where we have improved equity across city departments and where we need to go in terms of improving equity. It's a simple, accessible framework that will guide us to assess potential health and equity implications. It can be used for existing or new programs, policies, processes, procedures across the board. It can be looking at some very small piece of a program or a project, or looking at the whole thing. In some cases, we sometimes want to look at the sign-up process for something where we think the program is good and the project is good, but maybe we want to focus right on how people get connected to it, right? Whether it's our marketing, it's our, how we actually can, do we have to come down to City Hall to sign up? Can we do it online? Is it, how is it accessible? That type of thing.
So how often you monitor and control? How often you look at this? You have a team that you work with, you working with?
That's the team, the interdepartmental equity team. So those folks that are on that whole group, there's about 18 or 20 of us, and
Wow, that's a lot of
we're
people.
stood up on around each of those pillar areas,
Yeah,
right?
the
The
small
5
groups,
pillars. And
yeah.
so within their small groups, if there's a program or a project in the health department that is dealing with health that we'd like to look at, that small group that focuses on health and healthcare, we'll take a look at that one. For instance, we did complete one looking at the outcomes from the lawnmower program, the lawnmower rebate program.
That's a good program.
And so they, someone on our interdepartmental equity team works in that division, and she brought the data, and she, went through their process, and that small group workshopped it, and then they brought the results to our large interdepartmental equity team. All of that stuff will come in our annual report too, so you'll see every single assessment and results that comes out from all of those small groups working together throughout the year.
So when you see glitches, when you guys meet, let's say majority time when you have when you go into your process analysis, it's workers. So you stop and or coaching counseling is ongoing, or or how do you handle that?
So it's a little bit different than like a quality assurance project. This is kind of looking at processes and kind of overall, we're specifically looking for where there's an equity impact, a negative equity effect or a negative health impact. And so those are the recommendations that we're making.
Right.
So as we go through these, we'll see points where like, oh, maybe you could have made this process, the sign-up process, easier by A, B, or C, or you could have lengthened the amount of time that people had to do this, or was any part of this cost prohibitive for residents? Things like that, and we write that out at the end of the assessment in recommendations to give back to the folks that are in charge of that particular program or initiative for them to review the recommendations of the equity team to say, you know what, we could do this differently, or we could do it this way to have a different outcome, right?
That's good
And
stuff.
it's
That makes
also
sense.
in conversation with the folks who submit their program or their project, they want to do an assessment on it, then our team is actually working with them to, a lot of times you'll see for certain things that we do, people will say, well, we don't really collect data, or we don't really have data. Yes, you do. Your sign-up sheets are data, right? When you get demographics on the folks who are participating in your program, that's data. When you take someone's address and knowing what part of town they live in, that's data, right? And so looking at that participant data is data. So a lot of it is helping the folks who are doing the project or doing the program or process to understand how to look at it, and then being in conversation with them through these these 6 little, pages of here's what you put here, here's what you put here, and then tell us about it. Tell us how it's working for you. Tell us what you're running into. Tell us what questions you're having, right? And so we can ask questions, they can ask questions through this whole process. It's not a blind process. It's not closed, so that we can massage this and come to some resolution at the end where we can say, aha, these are the takeaways of things we can do a little differently to make it better.
I like this stuff.
This is kind of what it looks like. It's a fillable PDF form. Again, this is not designed to be cumbersome or hard. If at some point we were to either at the health department, or if city council were to adopt this tool and say for folks who are contracting with the city of Cleveland, we want them to have this equity assessment as part of their package, it's not designed to be cumbersome so that it would discourage people from doing this or doing business with us. It's actually pretty simple. And then the team is there to help folks through what they need to put where and how does it work kind of thing. But this is basically how it's set up, looking at just how you're categorizing things. Are we looking at a regulation? Are we looking at an ordinance? Are we looking at or an organizational policy? Like, what is it exactly that we're looking at? And then you give us details about what it does, who it's for, and then that helps us, you just answer this series of questions, helps us determine, based on your outcomes and the data that you provide, does this work and is it equitable, right? And if it works, but it's not quite equitable, then we're able to interject and say, here's some ways that you could make it equitable, right? Likewise, we may find someone completes this on a policy procedure process, and it's perfect, right? We might find, wow, they are really addressing equity, or they don't have a negative equity gap or a negative health impact. And we are able to quantify that and hold it up and say, this is a process that works. How do we replicate it, right? And how do we take what they did and interject it into other policies and procedures to make them more equitable?
And sometimes the enhancements that come from this group is not necessarily dealing with race or gender or equity in a sense. A lot of it is equity, but sometimes it's structural. For example, if you look at the paint program historically, paint program was not used by a lot of people in certain areas. Well, some of the paint is sitting at home in Mrs. Jones' basement. Well, we can
why?
We can look at the structure and say, well, wait a minute, now Ms. Jones needs the painter to do the work. So these types of equity assessments also help just brainstorm solutions to make the programs better. Then we can come back to council and say, hey, we need painters included in the paint program. So that's an example of the value of the equity assessments. They're not just all equity or race or gender, but they're also programmatic solutions that we come up with.
Chair, I have a question.
You're like that. I can see that.
Hi. Who fills out this form?
So essentially, if you have a policy or procedure that you want to look at, you would fill it out. If it's not your policy or procedure or your initiative, but you still want to have it looked at, you would go to the folks who do that work and have them fill it out, and we would help them do that. And then it gets turned in, and then it gets workshopped. Yeah,
It turns its chair to
to the equity team.
the equity, okay.
Yeah.
I like the framework too.
So there is, you can look at the tool in its entirety on the website, and there's an explanation of how to look at it, how to use it. And we are in process of doing several of the assessments, which we're going to combine into an annual report to be able to show these are the things that we looked at, these were the findings, these were the recommendations that were made.
So when you'll show us the annual report, when?
Probably, we started doing them in the summer, so it might be a July 1 type. Yeah.
So if you see something going in a certain direction, don't wait until you give me the annual report. Start moving now.
Oh, no. So the recommendations and the actual finishing the process, that we don't wait for the annual report. Like, as soon as we do an assessment, then that team gets their assessment back, and we talk about where you had some gaps or where we had questions for you. It's kind of all along the process, and we definitely, and it doesn't take a whole year to do an assessment. They're actually pretty short. It's a few meetings of the team. But we give it back to them immediately so that they can start to work on implementing some recommendations or changes if they were
Some
needed.
people wait until the end. Say, oh, Councilman, we got a problem here.
No.
I mean, if you monitoring it, you know, it's just like the budget. You don't wait until the third quarter. At the second quarter, the indicators tell you, oh, we got some issues right here that we're getting ready to run into. Don't wait until the third quarter to tell me that you have a problem with the budget. You know, you see what direction it's going into if you monitor and control
Right.
it, mainly in the second quarter.
Right, and also there are certain instances where we are doing this at the beginning, you know, before a program or policy really gets started. This is what their
Right.
plan is. Let's run the tool on the plan to see if we would run into any problems like this. And in some cases, we're doing it as an after, you know, they did this program for a year. Here's their data. Tell us what these recommendations are, what we might need to do. Should we do this again
Right.
for the next year, right? So again, it can enter the process at any time, either on something that you're just planning to do or something that's already up and running as well.
Gotcha. Yeah, that's a good thing.
I'm going to move on to the Equity Advisory Group. Now, this is where we get to talking a little bit more about initiatives that speak more to diversity, equity, and inclusion. This group is also kind of all volunteer and ad hoc. There are a number of folks involved, Tyson and myself, of course. Hi, Kevin. Kevin Schmatzer's here. I saw Matt Cole here earlier, Dr. Margolius, Angela Shute-Woodson. There are a number of folks involved in this from different departments, again, looking at across the board of where we sit in City of Cleveland, really looking at where are we doing equity work, whether it's racial equity, whether it's diversity-based, whether it's inclusion and belonging-based, whether it's around health equity. This is what I was talking about, where we did an inventory to see what all of those initiatives are that have been going on in the City of Cleveland for decades, and what are some of the new ones that came with the new administration, and understanding where we are in terms of having certain things that are needed for diversity, equity, and inclusion. And I'm going to keep adding belonging on there as well. And so where we landed with this group is, maybe I just like threes, but I also divided this up into 3 parts, where we have 3 groups that are focused on different factions of where we are looking at our diversity work, at our equity work, at our inclusion work. And so where we landed is people strategies are what we consider for our staff and our internal teams, the people who make up the City of Cleveland government. And who works here. Think of it that way. Our community strategies, our strategies that affect how we do business with folks every day, our residents, our community that we serve every day, looking at what we need to do to ensure that we are having good, equitable practices around diversity and inclusion for them as well. And then our third group is physical and infrastructure strategies. And we met for about a year. And each of those groups came up with recommendations for the short term, which we considered 3 to 6 months, and more midterm or long term for each of those areas. And so we compiled our recommendations from all three groups based on those timelines, and then put them forth to Mayor Bibb. And the other piece of this, of having this group come together from folks who are in community development, folks who are in economic development for the city, is they were all able to tell us from where they sit, whether they're sitting in HR, whether they're sitting in OEO, where they know some of this work needs to happen or is already happening, and what our progress is on it. And so when we came back together in this fall, we were able to go through our recommendations again and see where we've seen progress. Some things were already underway. Regardless of the recommendation that we made, it was kind of like it happened at the same time. The group got together and said, hey, this is missing. We need to make sure this is happening. And then a few months later, someone from this section was like, oh, that is part of this project. It's happening this month. And so we're able to kind of quantify where we're seeing progress happening in terms of looking at the recommendations of these are the things that this larger group felt the city of Cleveland needed to move in terms of diversity, equity, and inclusion. And so some of those people strategies for our internal folks facing them was the need for updated and easily distributable all staff directories electronically. It's been sometimes hard to find people. You know, if it's hard for us to find each other internally, it's probably hard for folks from the outside to find us, correct? Standardizing customer service training across departments, and a lot of this you have to remember based on who we have in the room. Some of these things are going to fall in terms of its actual execution. Some of these things are going to be HR. Some of these things are going to be community development. Some of these things are going to be projects of the infrastructure. You know, we all have a hand in how these strategies roll out.
I have two questions.
Yeah.
Number one, so when you have workers, let's say people strategies, community strategies, physical infrastructure strategies, let's say you have 2 people working on people strategies, maybe 3. Do you have a cross? For example,
Yeah.
if I have 3 people working on people strategies, well, I wouldn't just put, for me, the 3 people there. I might have one coming out of people strategies, working in community strategies, one, and then they cross-train the different strategies while they're doing the implementation. So they are, I have to take them out of silos. I don't know, do you have them in silos or not? But while they're implementing that, I would have people going from different groups, cross-training.
So, thank you, Chairman. This is very similar to the setup of the interdepartmental equity team when we just talked about looking at it as sort of a project management. This is a whole group, right, that works together, all together, but they split off into their small groups. They make their small group recommendations, and then they come back together again to the whole group, and everybody workshops everything, right? Do you understand? It's similar to how we did it with
But you got people
interdepartmental equity team.
cross and going over the different ones, so they'll know. Is that correct?
So, working in those sort of digestible areas, small groups, so we have large group meetings and then we have small group meetings and we share our outcomes together. But what we found was there are strategies that were recommended by the folks who are focused on our internal people and strategies that were focused on the community that were the same, right? So we're seeing that a lot of the recommendations that we made go across more than one area. It's all coming together, but in terms of like management of it, it gets unwieldy when you have a large committee. It's about 18 or 20 folks on this. When you have a very large committee, you have to really manage and mete out what their commitment is, right? And so rather than have one person potentially have to be on all 3 of the small groups, the way you get buy-in, the way you get people to be able to complete and do and commit to something is they are a part of the large group, and they only have to be on one of the small groups. If they choose to be on more than one, that's great. But the team that supports this, myself and our Health Equity and Social Justice Division staff, as well as Tyson, we are the connective glue through it all, and support and meet between them and bring them all back together and make sure that each area strategies, that they're all working together. So it's a large team that's made up of the impact of a couple of small groups, but we are all working together, right? And we're all meeting together and sharing our outcomes.
And to give you an example, I think I was on the Physical Infrastructure Committee, and one of the things we talked about is the ADA assessment tool for this building and the City of Cleveland properties. And so if you look at the ADA assessment, Americans with Disabilities Act, it touches community. How does the community interact with our buildings, our structures? It touches people. How do our employees interact with the Disabilities Act and the way our structures are? So you're going to also, if you're on one committee, you're going to learn also the other items on the people and the community strategies, because
Right.
it's going to cross. A lot of them do cross.
And when we're working together, a lot of times our meetings are structured such as that we're working together all as one group, then we split off into our corners, and then we come back together as one group and share our recommendations and our findings, right? And so I don't believe that there's anyone on the group who only knows about the physical and infrastructure recommendations, because we've all been working on this together.
Of course, yeah, that's important.
Our focus and our energies to move things across the line come in that small group way of, getting folks who are involved, their very everyday work involves them in the physical and infrastructure strategies to move things across the line. But we come together as a large group to inform one another about all of the areas, for
Before
sure.
I yield to my colleagues, sorry for pointing at you, Director.
That's good.
Nowhere in this, you didn't narrate to me about purchasing and procurement. Purchasing and procurement is ongoing. And not just building things or cultivating workers, but who do we, our purchasing managers, purchase from? Like when we do just in time or whatever the case may be. That's ongoing. Because when you have a project, the project that you're monitoring, it has a beginning as well as an ending. Right. And it's over with. But that purchasing and procurement is ongoing, and we can create wealth for people of color. I mean, you know exactly where I'm going.
Right. Chair, one of the things, each department brought what we call what I call vital few items, as opposed to the trivial many. There's a lot of different opportunities that we could bring to the table. So OEO, we continually focus on procurement and how do we teach our subs, our vendors, how to navigate City Hall. So we didn't necessarily bring that one to this group, to the IET group, but OEO, in its core mission, works on those types of things with the Division of Purchasing. So everything is not particularly all the items. When I say the vital few, we can't boil the ocean. So we're bringing a few items to this team. Not every item.
Not every item?
No.
Okay. Because I'm big on purchasing and procurement.
Yes.
And they are the purse strings of any business. A lot of times we focus on construction, but that purchasing and procurement, everywhere, even in our households, purchasing and procurement, we're spending money.
Well, and I would love to talk to you about that. The contracts under $50,000, we have an initiative that we are really focused on, that the law allows us to be more intentional, I'll just say. So we have, there's over 2,700 contracts per year that come under $50,000. And so that is and you can have more than one a contract under $50,000. It's not a limit. So that's one of the things we're working on.
49,000, keep coming back.
Well, you can have 5 of those. So it isn't, I don't mean to limit it per se, but that's where we can be more intentional. They only have to be posted for 48 hours. You can be in part of our small contract rotation program. Not to take over this as an OEO session, but this is where we have to be intentional on those contracts.
Yeah, we didn't sit back and discuss that, because I was looking at that and wondering, have a jaundiced eye on that. I want to open up to some of the other council members because we have a caucus soon, and I'll talk with you offline on that. But any council members have any questions? Council lady.
Thank you. Just a quick question. In gathering together the different people working on DEI, I just wanted to check in briefly on the LGBTQ liaisons. Do we still have a liaison in the police department in addition to Kevin Schmotzer's role? Through the chair?
I'm not aware that there has been a new one at the public safety appointed.
Okay, so that position is open currently?
As far as I know, I don't know that.
Okay.
That has been refilled.
Hammer down on that. You gotta hammer down on that.
Well, that's why I wanted to ask at the table. I know it's not your department. I just wanted to know if this was kind of something that intersected with your work. Additionally, when we review and prioritize hiring of bilingual staff, do we pay additional for their language skills through
That's
the chair?
part of the discussion. We've talked with HR, and they have a lot of initiatives that they are invoking as part of our hiring process about how do you do that? How do you compensate either folks who currently work here and have a second language skill with a differential, or how would that work? So that's part of this work, is developing those strategies around how do we properly compensate folks, but also as we're recruiting bilingual staff members, is there something specific to make sure that they're compensated for that as well?
Thank you. And could you provide an update on number 2 under people strategies, standardized customer service training across departments? This is a really regular concern that we get at our office.
Yeah.
People saying, I called this department and the person wasn't very nice to me and hung up. And, we obviously, we know that our resident population base is coming in with a lot of mistrust of government. And often you call in when you're at like this heightened mode, right? And so I don't ever expect our staff to put up with abusive tactics, but thinking about what, from a customer service perspective, we're doing has been a recurring question for me. So I would love an update about that one.
Yeah, so from what I understand, as I talked about, that HR has a number of initiatives that are going to be rolling out in terms of training and standardizing staff skills and things like that. That is included. I believe they are working with a consultant to update the staff training for all city staff, as well as onboarding and handbook type policies is ongoing as well. But I believe that's where on our last update was that HR has some specific customer service training that's going to be standardized across the board for staff.
Got it. So
go ahead.
that has not been implemented yet. This is
Not yet.
ongoing.
Yeah, it's coming.
And in the meantime, while this is going on, we're just asking people to be good human beings. I'll give you an example. Someone came to OEO the other day looking for funding. Well, OEO does not fund projects. So we walked them down to economic development as opposed to just sending them down there and gave a warm handoff.
Yeah.
So those are the things we're asking people to do in the meantime, just to be a good human, be a good employee, a good person, and to do those things. And that goes a long way.
Yeah, I think that's right. And obviously, if we were getting everyone to just be a good human, we would we wouldn't be here. But I think particularly like the frontline, like building and housing staff who are dealing with just a lot of folks who are themselves confused about changes. We get a lot of complaints about people not feeling like that warm handoff has happened. So understanding what we're standardizing and what the expectations are, I think will help us address some of those customer service questions. My last question is, through this, has there been any, can you confirm that the city has a current language line contract and any information about how that's utilized by staff while, not essentially relying on sort of the unpaid skills of a staff member who happens to be bilingual, either in Spanish or another language, but in actual translation service available through the city?
We do have access to Language Line. I know at the health department we have it, and I'm assuming that is citywide, where there's the sticker.
Oh, I wouldn't assume that. Can we confirm that?
I don't believe that it's just the health department. There's a sticker on your phone that tells you how to access Language Line, and that by having the call with Language Line attached, it provides a translator on the call with you.
Yeah.
So we do have access to that if we need it.
Yeah, through the chair, could I ask as a follow-up that you confirm if that language line contract is available to the entire city? I'll just share that my first year in office, I wanted to access language line, which I've always had access to through when I was at Legal Aid. It was a common practice for us to have that. So, the first time I needed language services, and it took 4 weeks to get the staff member at City Hall who knew that City Council had a separate language line contract and that we had access to it. And then I was told I was the first council member to use it in many years. At a minimum, City Council has a separate language line contract. And so if multiple departments are using language line under different contracts, we should combine them. Or if only health is using it, we should make sure that everyone has access to it.
I will follow up with that.
Thank you. Through the chair, those are all my questions.
And you'll
Thank you.
follow up with that when?
Today?
It would take some time.
Because when someone tell me they're
Chairman-
gonna,
Chair say
or as
when.
soon as possible, or
Yeah,
follow,
yeah.
you're not telling me a time or a
Well-
date. I always.
One
and
day. It's
you're
one
right.
day, Chair.
Right, I was trying to be smart with it. I always like the date stuff. Because, in City Hall, I hate to say this about us. If you say as soon as possible, or if you don't put a date with it, like, you need to say December the 17th or the 11th for it to be, you know what I'm saying, for you to give it back to me. Because, your date and time may be different than mine.
That's true.
Council Lady.
I thank you very much. Those are all my questions. Thank you for, I know this was covering a lot of areas that aren't necessarily in your purview, but that touch on equity issues, so thank you for the time.
Sure.
Councilmember Chris Harris.
Thank you, the chair, to the commissioner. Thank you, director. Just first and foremost, I just want to thank the collective team for all of the work that you all have been doing over the years. When you go to the slide of the 2024-2027 Interdepartmental Equity Team Strategic Plan, the first thing it says, November 2019, 400 Years of Inequity Cleveland Summit.
That was intentional.
Is that on there now? You see it?
Yes.
Yes, it's on there.
It's on there.
So
in the
I
highlight.
really want people to understand where we're going, which started from a summit that talked about 400 years of inequity. You do not recover in 2, 3 years, 5 years. This is going to be life work. Life work. In and a time and a space when you have an open government, different government agencies, an open federal government who is anti all of the things and trying to tell you to get over it, and have strong influences that talk to people very boldly about people shouldn't feel guilty regarding their parents and their grandparents and their ancestors' work, which is asinine. So we need to be very clear, the work that is in front of us. So I want to thank you all. It is going to be very challenging for us. And so I will like to lift up specifically as we are going through this work to do what we know is right. Policies from the local, state, and federal government have created these conditions.
Yeah, that's true.
Created these conditions. This just didn't happen. These were intentional structures that created it. And so the one thing I'm very excited about was the health and equity assessment tool. My question is, through the chair to the commissioner, do you think this health and equity assessment tool is something that we could utilize here in Cleveland City Council?
Through the chair, it is my hope that ultimately Cleveland City Council would want to adopt the same health and equity assessment tool, so that, one, we would be a cohesive unit across, doing the same type of process across the board, but also I believe that it would be important for us to not only assess the policies, practices, procedures that we do internally at City of Cleveland or on our internal, as we are contracting and partnering with community partners, but it would be my hope that we could do this on a broader scale, but also, and to make sure that we're working toward the same equity and health impact goals.
And so just a follow-up through the chair to the commissioner, how do you think we can start that process? What does that look like to begin to have a, unified approach to assessing? Specifically, our wheelhouse is the policy realm, right? So what does that look like, and could look like for us to explore in Cleveland City Council, utilizing the health and equity assessment tool as we think about the policies that we are enacting here in the city of Cleveland.
Sure, I think part of it is in the way that we've done it internally, we were considering this phase as kind of like a pilot phase, so that the first assessments that we're doing, we're also assessing the tool itself to see is something left out, or is this easy enough to do, or do we need to change any part of it? So I think part of it is kind of doing a voluntary assessment to kind of see if this is something that you guys would like to use, or would you be interested in doing something different. I will tell you, as we adapted this from the National Public Health Law Institute, other cities are using it in different capacities. Some of them, their council folks are using them. Some of them are using it internally. I believe I'm not sure about now, because we've been in this process about a year from the time that we took their tool and adapted it to work for us. But at the time that we adapted it and we were consulting with them on the use of it, they told us that we were the first team that was using it on policy.
Oh, that's good.
And so I think that, and how we've adapted it to use on policy. And so I think probably a good first step would be a little bit of an in-depth meeting to kind of explore the tool and understand it and see how some of the other assessments look when we've done them on processes and things like that. And then maybe to partner on doing a pilot of a pilot assessment or two on a policy, if that's what you're interested in.
Yeah, so I would like to offer to the committee and to council that we set up a introductory meeting specifically looking with our policy team, my policy director, to be able to go through, to have this in-depth meeting, to be able to assess what this tool looks like, maybe, and really just go through the process to see what can it look like and what adjustments can be, we can look at as we are going through our legislative process. And so if I can be of assistance in that, I'll be more than willing, my office would be willing to do that.
Thank you.
Thank you.
Yeah, that's pretty smart. You're right, because you have to measure policy. You know, policy can change on you. You could craft something, let's say, it's always moving. It's a breathing document. And if you don't measure it, it can get away from you. So what you legislated in 2024 could be different in 25 because some of the things you mentioned, the community, physical infrastructure, whatever the case may be, it could shift on you. But you guys have systems in place on how to measure the policy, which is really, really good. And I haven't seen that in the state or even with the feds, how you measure policy, and that's important. So I'm real happy about that. Council lady? Any other questions? We have caucus we have to prepare for, and I could meet with you in private to finish doing this here, because we can't be late for the caucus.
Understood.
Because from caucus, then we have to get to finance. So, you know, I'm on time constraints right now, so I'm sorry about that. It was a great presentation. Can I have that copy?
This has my notes on it, but you do have this in your
Oh,
email.
you're talking about me in your notes.
Right.
Oh,
Yeah, yeah. So you want me
have
to
I
see the
ever
notes?
not taken notes?
Nah, I'm not giving you my notes. But you'll give me a copy of it later.
It's
today.
email. It was
Yeah.
emailed to you.
I already asked.
You have it.
Yeah, and we'll pull it down.
And you have the links to get to the strategic plan as well as the equity assessment tool that you could look at the tool yourself.
Right. And if we have any questions on it, we will reach out to you. But
Also included this, you'll see a PDF of this. This is that equity inventory that we did to look at across the city of Cleveland, where are we seeing work that is related to racial equity, social justice, diversity, inclusion across the board. So I would ask you to take a look at that.
There's a lot of
just to-
departments that already doing equity work, and there's no centralized place. We're trying to be that centralized place to capture where all the equity work is going on in the city.
However, you know, in the meantime, the work that is happening, even if it's not necessarily centralized, I think it's important to note that it is happening in multiple areas of the city and has been for a very long time. And thinking about that equity advisory group coming together from all of those areas to be the folks who put together these recommendations to give to the mayor to say, this is where we're seeing we need some work done.
That's good. Because, you know, we have to take leadership if we're pushing the external, and if we're not doing the internal work, then you'll have Cleveland Clinic or University Hospital, whatever the case may be. We're saying we need to do this. They're like, well, you guys aren't doing it here in the city of Cleveland. Show me the proof. But you could quantify it, and then that way you're able to show the proof and the outputs, which is very, very important. Because you got to, one thing about leadership, you have to show it. And so we got to do it. So thank you. Any other questions? With that, the Health Committee
you
is
for
now
having me.
adjourned.